interesting. The question I had come up was, why are more young people getting cancer? And it's really true. If you start looking at all the numbers, in the past, the cancers that the 30-year-old patients of mine are having now are what we used to see in 60s. So the question is, what's happening? And really the answer is we don't know. And if anyone is claiming that there's one simple explanation, particular food, chemical, lifestyle choice, they're really truly getting ahead of the science. But researchers are beginning to identify several pieces of the puzzle. An important clarification: cancer is not rising equally across every cancer type or every group of young people. So, the study that came out from the National Cancer Institute analyzed patients between 2010 and 2019, and 14 cancer types increased in at least one group under the age 50. Now, the most significant increase is actually breast cancer, colorectal cancer, kidney cancer, uterine cancer, and pancreatic cancer. So the question becomes, all young people are suddenly getting cancer? So, one possible, uh, I guess, explanation would be that people that are born in more recent decades may have experienced a different combination of exposures beginning in childhood, even before birth, than previous generations. So, no one exposure uh, is enough. It's typically a package. So, our food is different, our environment where the food is made is different. Antibiotics are added to almost everything. Obesity, metabolic disease are a whole lot more common than before. Physical activity has declined, and reproductive patterns have definitely changed. We're not having as many kids. So, when you take the mixture of the chemicals, the pollutants, as well as whatever the heck they're putting in our environment, the things we know and we don't know about, and you add to it lack of exercise, obesity, distress, uh, it definitely can give us an answer as to why is it that younger folks in their 30s are getting cancer. Now, keep in mind, fat tissue is biologically active, so it could influence hormones, mainly insulin signaling, which is a big part of this. Fat tissue can also affect the immune activity. It causes chronic inflammation. And so obesity is associated with cancer of the colon, cancer of the pancreas, cancer of the kidney, and basically postmenopausal breast cancer and endometrial or uterine cancer as well. So obesity alone cannot explain it all. Some young patients diagnosed with cancer are lean. They're physically active. They run, they exercise, they look good, they take care of their weight. So, researchers are all putting their hats together and they're looking at highly processed food, low fiber intake, sugary beverages, vegetables, whole grains. But to be very honest with you, it is so difficult to isolate one food from everything else that a person eats and kind of blame everything on that over the next decade. So, the microbiome or the bacteria that lives inside our body definitely is different now. Our diets are very different. Antibiotics are rampant. Infections are very different. Birth methods, such as a lot of C sections, are different. Our medications, environment, all of them put together can cause what I would consider damage to the DNA of us. So The beauty of it is that there is promising area of research, especially in cancers like colorectal cancer, that is looking for causes that we didn't know about before. And now that this whole accelerated biological aging is a topic interesting to us doctors, I think we'll be able to come up with more ways of looking at this and hopefully come up with reasons that are easier to explain as to why younger patients, or better yet, why is a 30-year-old now having a 60-year-old cancer. So the part that I can't really do a whole lot about is the pollution, air pollution, pesticides, chemicals, occupational exposure, microplastics that you can even find in your bottles of water, etc. So we don't really know a lot about it, but I like to be a scientist. And there are environmental agents that are carcinogens. And again, they may be more rampant than they were many years ago. We all kind of know that. Uh, so, with the usage of genetic testing, monitoring our higher risk patients, hopefully we can detect this sooner in our younger patients. Inherited genetics such as BRCA1 and 2 mutation, Lynch syndrome, these are things that we can actually check for. And so it's important for us to know uh, why is it that this is all happening. But the caveat is that our genes have not really changed so dramatically in the past few decades. So genetics, even though are important, the vulnerability to develop cancer doesn't all fit in one picture. So what am I getting at? I kind of feel like we gotta remain active. We gotta try to eat whole foods as best as we can. We gotta get checked out for easy cancers to detect, like uterus, breast, uh, the ultrasound of the pancreas. And what should young people do? Don't panic. Don't assume that the cancer that your grandpa got at 60, you're going to get at 30. That's not the purpose of this at all. But also don't ignore your unexplained rectal bleeding, persistent abdominal pain, iron deficiency in a guy for no reason, a lump in the breast or a chest wall of a man. Oh, this is not just me having a fatty tumor. Go get it checked out. I got close to 30 gentlemen with breast cancer. Know your family history, and follow us. You know, come see us, talk to us. We're just as interested to figure things out as everybody else is. The recommendation now to check for colon cancer is at 45 rather than 50s. I've been recommending mammograms really more often than not. You know, once you're 40 years old, I ask you to do one at least every 2 years. And pay attention to the mold in your house. Pay attention to smoking, avoiding alcohol, staying active. Be healthy, whatever that means. But at least fiber-rich diet, vegetables, and protecting yourself from excessive ultraviolet exposure is important. Getting an HPV vaccination, hepatitis B vaccination that's available. You don't have to do it the minute you're born, but you got to do it early on. I think these are little things we can do. So bottom line is it's awareness, and I think the answer is more likely to be a web of exposure and biological changes across the board rather than one simple thing. So, National Cancer Institute reports an increase among younger adults in breast, colon cancer, uterine cancer, kidney cancer, pancreatic, and several other cancers. But luckily, these may be different that, than the cancers that our grandparents had, and more importantly, we sure as heck have much better treatments. I hope this has helped. Have a wonderful rest of your day, and we'll see each other soon.